All right, continuing on with this toxicology fundamentals lesson, we're going to talk about dose next. We just finished talking about exposure in the previous video lecture. So these two things are related, okay? So think about exposure as like what's out there in the environment that you've been exposed to, right? And think about dose as like what have you actually experienced? Like what has your body truly encountered? So dose is the amount of a substance received or administered at one time. Dose is usually expressed as being either what's administered or what is absorbed, right? And we're mostly going to be interested in what is absorbed because this is what has truly accessed the body and therefore can cause a harmful effect, okay? Now this term, and really this is true for everything you're going to learn about toxicology, there's a lot of overlap between studying toxicology and studying pharmacology. So toxicology is the study of poisons in brief and harmful effects on the body. Pharmacology is the study of beneficial drugs, therapeutic agents, right? And how they can help the body, help to cure or reduce disease levels in the body. In both circumstances, though, we're talking about chemical effects and the body, okay? So if it's a drug, you might be given the drug on purpose, right? And what you receive or what you're administered is the dose. What you absorb is the absorbed dose, right? So like you take a couple of aspirin, the dose is whatever was written on the bottle as the amount per tablet that you consumed, and then we could do some testing on your body to see what you actually absorbed and how much aspirin got into the tissues of the body that are targeted by aspirin. And that would be the absorbed dose. For toxicology, usually it's not on purpose, right? So usually you're taking this toxin in by accident, like you're inhaling something toxic in the environment or it's gotten on your skin or so forth, right? And either way, whatever you are exposed to and actually contacts your body, that would be the administered dose. But we don't use that term a lot in toxicology. It's usually more for drugs. But what you take into the body, that would be the absorbed dose. Okay. All right, so what influences how much of a chemical is actually absorbed and therefore contributes to the absorbed dose? The exposure concentration, so if you're exposed to more, you will probably absorb more. The exposure route, like how you come into contact with that chemical. The nature of the toxin, particularly its bioavailability, although there are other factors too, like how quickly you can metabolize or excrete it, if at all. And then the time of exposure. So let's touch on those a little bit. The time of exposure is very important. So longer exposures typically mean to greater absorbed doses, right? And this ties into a couple other terms, right? So an acute exposure is a short-term exposure, might be minutes or hours or maybe days, right? And usually it's to a relatively high level of contamination. And acute exposures lead to acute effects, right? A chronic exposure is a long-term exposure, years to a lifetime or to portions of your lifetime, typically to relatively low levels of a contaminant. And chronic exposures cause chronic effects. Route of exposure. Here are the 4 classical routes of exposure. Injection, so this might be how you would be exposed to an opioid drug, for example. Absorption through the skin, also known as dermal absorption. So you touch something, you get gasoline on your hand, and some of those chemicals are absorbed through the skin and they make their way to your blood and your brain and so on. You might inhale the chemical through breathing, bringing it deep into the lungs, or you might eat the chemical somehow. Maybe you're a painter, there's lead in the paint that you're covering up, and you get it on your hands, and then you don't wash your hands before you eat because you can't, because there's no hand washing available in the area, and then you will eat those lead chips and it will get into your body through ingestion. Because the surface area of the lungs is so large, and because the lungs are literally biologically, their purpose is to allow chemicals to go across them in each direction, so O2 in and CO2 out of the body. We usually worry about inhalation the most of all of these routes of exposure because it can pose, in many cases, the greatest risk to exposure. I also want to mention that another route of exposure is to the developing embryo or fetus when a pregnant woman is exposed to a chemical. And so the barrier, which is called the placental barrier, that divides the pregnant woman and her developing embryo or fetus, it does allow chemicals to go across. It's selective in those chemicals, but if a pregnant woman is exposed to a chemical and that chemical is actually absorbed by her body and is in her blood supply, then the placenta can very much be exposed to that chemical as well. And that's a particular concern because many chemicals are able to cause birth defects. They're what are known as teratogens. Bioavailability means the physical and or biological state of a substance, rendering it capable of being absorbed into the body. So in simpler terms, it is how easy the chemical is to absorb. Okay, so for drugs, we want to have really high bioavailability because we want to take small pills and get the maximum concentration in our body, right? Whereas for toxins or poisons, the higher the bioavailability, the more you'll be exposed to, and the more toxic effects you will typically see, right? So here are some antibiotic chemicals. These are drugs, they're therapeutic agents. And they have very different bioavailabilities. So doxycycline is very, very bioavailable, whereas some forms of penicillin, this particular form, 60 to 79% is bioavailable when taken orally. And the chemical, let's find another one, azithromycin, not particularly bioavailable, less than 60%. This is why azithromycin pills tend to be really big because you have to take a lot of it in order to get to a high enough dose to be effective. We measure dose using concentration units typically, but usually that concentration is the amount of chemical of interest per body mass unit. So it's something like milligrams per kilogram. Okay, and so what I posted here, this might seem a little confusing to you because I posted the dosage chart for Tylenol that I found online. I don't know if it's super accurate. I don't know if it's outdated or not, but I just wanted to give you the idea. And so if you're an adult, one dose of Tylenol is 650 milligrams every 8 hours. Okay. Adults have larger body sizes, so we are able to tolerate 650 milligrams because when you take 650 milligrams and you divide it by a typical 50 kilogram adult, you get a fairly small number that is not toxic and is instead therapeutic. The pediatric dosing guidelines, if you take a look at them and you focus over here on the left at the milligram quantities, right? A small baby that's only 6 to 8 pounds is only able to tolerate 40 milligrams of Tylenol because their body weight is only about 2 or between 1 and 2 kilograms. Once the child starts to grow, as their body size gets larger and larger, remember it's 2.2 pounds in every 1 kilogram, okay, for the metric conversion. So a 95-pound child, for context, if we divide that by 2, we're going to get 72 divided by, we're going to get about 30 kg, right? You're going to be able to tolerate up to 500 milligrams, which is getting close to the adult dose. Okay, so the dosage that we have here relies on body weight. So in order to avoid overdosing a child, it's super important to read the dosing directions. All right, next, we're going to talk about dose response curves in the next video.